Welcome. Now let's talk about the key points of a split night sleep study report. Alright, first of all, what we'll do is we'll define what a split night is. The next we'll talk about the criteria for a split night. And the third thing, we'll talk about the goals. Alright, let's get started. So the definition of a split night is where the patient undergoes a diagnostic portion of the sleep study, followed by a therapeutic portion of the sleep study. So the diagnostic portion of the sleep study is what the patient undergoes initially, where they are hooked up with all the monitors and so on, and nothing is done except observation of their sleep, breathing disorders or any other abnormal sleep behaviors or even leg movements and so on. So that will be under the diagnostic portion of it, and then followed thereafter, if the technologist sees enough events, for example respiratory events, they may decide to then treat the patient. So the therapeutic portion where they put on the CPAP comes in. So that is the definition of a split night sleep study. Most labs nowadays should default to a split night for the realities of healthcare reimbursements and so on, to try to get as much done during one visit rather than have the patient come back for another night for the CPAP titration. Though there are a minority of patients that will require a full night sleep study, wherein the patient just sleeps throughout the night and there's no interventions taken. And these are patients mainly with neurological issues and so on, where there's a suspicion of, for example, a nocturnal seizures, patients with abnormal sleep behaviors, for example, sleepwalking, abnormal dreams, and so on. At this point, these patients are even patients with hypersomnia, so they're excessively sleepy, to the point of suspicion for hypersomnia or narcolepsy, for example, then a full night sleep study would be required. All right, so that's the definition. Now the criteria is for, as per the American Academy of Sleep Medicine, the recommended criteria is above AHI of above 40. So if, for example, in the span of 2 hours, the patient has 80 events, then they will meet criteria or recommended criteria to split the night. However, it is also suggested as well in patients who have 20 and above, so that meaning 40 events over 2 hours, that would also be a suggested criteria for these patients to then undergo a split night. But in most sleep labs, if there's any doubt about the criteria or even whether they've reached that minimum amount, the idea is to continue just for a full night if there's any doubt about whether the patient has met criteria or not. Now the goals of the split night is to assess for CPAP titration adequacy or optimal pressures. So for further details on CPAP titration, please refer to the talk on key points for CPAP titration. And for other points regarding the actual diagnostic portion as well, you can refer to key points for an adult baseline PSG report or sleep study report. So the goals, like I mentioned as well, is for not only to make an adequate diagnosis, but also find an optimal pressure, wherein the AHI for that patient is reduced to less than 5 ideally. And for example, if the patient has, after the sleep study, the titration shows that the highest pressure tested was still highly inadequate to treat the sleep-related breathing disorders, then two things can be done. One is whether the patient should just be put on auto-PAP after that, or whether the patient should be brought in for a repeat sleep study. So those are the two things that can be considered. And so basically now we've covered the definition, we've talked about the criteria for a split night, and we've talked about the goals of a split night. If there's any other questions, please refer to my key points for adult baseline PSG report and key points for CPAP titration. Thank you.